There's a lot of opportunities for GPs later on. There's educational opportunities, so to train other GPs. You've the opportunity to specialize in anything you want to do later on as well, dermatology, pediatrics. You can really kind of own your career trajectory.
There will always be a bit of laughter and joy coming into the practice all the time. So that is amazing experience.
From my point of view, it kind of has it all to a certain extent, and I feel lucky that I have made the decision at the time that I made it to kind of, in certain terms, to kind of jump ship and just to move to a rural area to work.
I think ultimately what I was looking for was a bit more stability in my career and a little bit more variety in my scope of practice. And I think that's what ultimately led me to the GP scheme. It sort of encompassed both the stability of working in primary care, but also the variety that comes with working as a generalist.
Some people like to go straight into partnership and to run their own business. Other GPs like to specialise, maybe work in hospital clinics or run their own specialist clinics.
There is that flexibility once you come out of the programme to choose largely what you'd like to do and where you'd like to do it, and not all disciplines offer that.
Welcome everybody, and thank you for joining us on the webinar today. We know how busy you all are. We hope you'll find this webinar helpful to complete your application and to understand the 2025 trainee recruitment process. For your information, the chat function is being disabled during all the presentations in the hope that we will answer most of your questions during them, and it'll be enabled at the end for any questions that remain. We're also asking that if any personal queries, please don't post them to the chat. Email these to gptraining@icgp.ie after the conversation today. The webinar will be recorded and will remain available over the coming days. So just to start with some introductions, my name is Dr. Kathy Cullen. I'm a GP and also the National Director of GP Training. We also had today with us Dr. Ronan O'Connell, also a GP and the Dublin Northeast Regional Director. And he's going to go through the SJT, CPST tests, MMI, scheme selection, and an offers process. And then we also have Martina MacDonald, GP Training Unit Manager, who will go through the application process, application A and B. And we have Pauline Tierney, Central Coordinator, who will answer questions on the chat, which will be disabled until the end of the presentations. So, and we will move between presenters. We're going to take you through the process in the order that you will hopefully experience it. So just to start with why general practice. So we hope you're all here because you already know why. For myself personally, when I said I wanted to study medicine, I always meant that I actually wanted to be a GP. And I would really say, why would you choose any other specialty? Because we get a little bit of everything. And depending on your interests, as time goes by, you can get a bit more of everything. And the concept of special interests, which was referred to in the video. So we're generalists, and really our significance and importance to the healthcare of the nation is being increasingly recognised. And that is seen in the fact that general practice is better remunerated than it was previously. And also that there is a huge amount of opportunities for you to work in both local areas and then nationally and indeed even internationally. Though we do hope that you will all stay and contribute to the healthcare of the Irish population when you've completed your training. The other big advantage of general practice is because you are effectively an independent practitioner, you can have significant control over your own working life. And at different times in your life, depending on other demands, you can work more or less and combine that with what works and suits for you. It is a challenging as well as a rewarding career. We take care of patients from the moment they're conceived, sometimes even before they're conceived, right up until the end. We look after complex multi-morbidity, and we develop relationships which are often personal and also very rewarding with the patients that we see over a long period of time. And then also you have your support from your fellow GPs in your ongoing education that the college would be very involved with offering you on a daily basis. If we move on, thanks, Ronan. So our GP training program is set in it has a regional structure, and there are local schemes in the areas listed here. And we'll talk to you a little bit more about that later on. So we will work very hard at geographical alignment, meaning that we will get you to stay within the area that you're in, and your training will be where you're placed for the full 4 years. There are some historical placements that may not be quite within the local scheme, but we will really minimize travel as much as we possibly can. So moving on to the next slide. Thank you. So what does training in general practice look like? I hope most of you have already looked at the prospectus and have an idea. But the big thing about general practice training is by the end of 4 years, presuming all goes as it should, you will be eligible for the specialist register. And within that, we have some doctors who, with recognition of prior learning, which Ronan will talk about in a little more detail later on, that may be as little as 3 years. So you spend 2 years in hospitals covering the major relevant disciplines for primary care, and then 2 years in each of 2 different practices. GP training is very much trainee driven, but you have both educational and clinical supervision throughout. We have a competency-based curriculum, and you will have assessment using EPAs, which are known as Entrustable Professional Activities. And this is considered the highest level of assessment, looking at you in your workplace and how you're performing, as well as examinations of the MICGP. In years 1 and year 2, you get a half-day release where you're excused from the hospital rota to go spend time with your peers and to learn about relevant topics. And then in year 3 and year 4, that is a full day, and that's considered part of your working week. And your educational program will be delivered by your scheme in small groups of your peers, and occasionally remotely by blended learning, which is of a very high standard. And throughout your GP training journey, there's a very strong ethos of team learning. You become very close and familiar and get a huge amount of support from your fellow GP trainees. So where can you find out more? So if you want now to take a screenshot of that QR code, that will link you directly to more detailed information. But we're going to take you through a lot of the nuts and bolts of the application process now at this stage. I'm going to hand over to Ronan for that piece. Thanks, Ronan.
Sorry, Ronan.
Lovely, and I'm going to very quickly hand over to Martina.
Great. If you want to move back just one slide, that would be great. You're all very welcome this evening, and thank you for joining us. We do appreciate your time is precious, so we won't keep you any longer than necessary. I just want to flag these 2 essential reading for application to GP training. The first is the prospectus booklet, which both of these documents are online. The prospectus booklet gives you an indication of the structure, as Kathy says, to GP training, the regions, the schemes, the intake, and of course our vision and mission as well. The second document is the guide to applicants, and that will take you through in detail the process for GP training application. It'll give you the information in relation to what documents you will be required to submit with your application, and of course it'll give you the key dates as well. The other area I would refer you to is there's a frequently asked questions section on our ICGP website. So if these documents do not answer your questions, there are some important ones there that you can refer to. There is a huge volume of inquiries for GP training, so I would encourage you to look and seek your answers in the documents first before you actually email us. Ronan, if you want to move on. Great. Prior to making your application, I would stress that you need to read the eligibility requirements. The application fee of €75 is non-refundable, so I would ask you to ensure that you are eligible before completing your application. So the criteria is that you will be eligible for the trainee specialist division of the register, the Medical Council Register. It's not required that you actually have registration at application, but that you are eligible for it. The second then is you are required to meet English language requirements, competency requirements, these are set by the HSE, and these are outlined in the application booklet. We also require that you have a minimum of 9 months paid clinical experience, and that's in acute hospitals. Great, Ronan, great. This is an infographic which is taken from the guide to applicants. It's a busy slide, so I do apologise that the quality mightn't be great, but I suppose it just demonstrates that it is a complex process, but it will start with the applicant making an account on the ICGP website, and there you will start your application process. Application A is not an onerous application. It requires some basic information, and I will just take you through what information we will require for that process shortly. Ronan will talk you through the SJT, which is a situational judgment test, and a clinical problem solving test shortly. And that takes place on the 31st of October. I'm sure that date is already in your diary, but just to flag it. So if you're successful in that process, we will ask you to complete a more detailed application, which is application B. And at that stage, you'll be required to submit evidence of your eligibility, your English language requirements, your medical degree, and if you're applying for recognition of prior learning, your documentation for that. So again, we will review all the applications and the documentation once the application B closes, and we will notify people if they're eligible for the next stage, which we will invite applicants then to submit their references ahead of the interview process. The interviews take place on the 12th and 13th of February, and a series of multiple mini interviews. Once you're successful in that phase, you will then be asked to your score for the SJT, the CPST, and the MMI will be combined, and you will be asked to make a STEAM selection. We do take into account the HSE national allocation policy, which all training bodies are required to do, and then we will make a rank and match offer to you. Right. Next, please. So these are some of the key dates. The 21st of October is when application A closes, and I would encourage you not to leave it till the last minute to submit your application. You have plenty of time. Go and read the booklets and see what you need ahead of time. The 31st of October is the online SJT and the CPST, and there are a number of sittings, so we will ask you to indicate your preference in terms of the selection time. We may not be able to facilitate all the requests, but we will do our best. The 20th of November is when we will advise applicants of the outcome of that process, and those who are successful will be invited to complete application B. Application B then closes on the 4th of December, at which stage we will review all the applications and the documentation. You will be required to submit 2 references, and one must be your current employer and one other. And these are on BST standard forms, so they will be needed if you are successful in the process. And they will be required to be submitted prior to your interviews on the 12th and 13th of February. We will be giving deadlines for that in January. Great, thanks. This is the information that we will require as part of your application A. Some of the information when you register on the ICGP website, we will capture some of the data, your name, your address, your email address, so you won't have to resubmit this information. It'll already be captured. This is the additional information that we require, which is not captured as part of that process. So it's the nationality, your current work permission in Ireland, your country of graduation, your current intern post or your SHO post, and if you need reasonable accommodations for the SJT and the CPST, you will be required to indicate that at that stage and support the relevant documentation indicating that you will need that. We'll also ask you to indicate your preferred SJT and CPST time, and the first commencement time is at 8:45. That's the first slot. As I said, we will not be able to accommodate everyone in their request, but we will do our best to accommodate most people. Great. And I'll hand over to Ronan.
Thank you, Martina. So over the next 10 minutes, I'm going to talk you all through the shortlisting assessment, which is 3 weeks from today. Then you'll hear from Martina again, and then I'll come back and talk to you a little bit more about the interviews and the offer process. So our shortlisting assessment is comprised of 2 different tests, the clinical problem solving test and the situational judgment test. To proceed through the shortlisting onto interview, you need to meet the standard for both tests. It's important that I say this now, that the ICGP or the question writers don't support or advise any specific resources in terms of study aids. A lot of questions come in about that. If you look, again, this is going to be my first time plugging it, and Martina's already plugged it, but look at the guide to applicants and that will give you a lot more information. So as with everything in postgraduate medical education, our assessments are competency-based. So the whole way through the process, we're looking at and assessing different competencies. So this is a list of competencies that were drawn up back in 2013, which were found to be relevant to general practice, and that's what we base our assessments on. And different aspects of the recruitment process will look at different things. So the clinical problem solving test will look at clinical knowledge, and then we look at different things in the situational judgment test, and then different things again in the multiple mini interview. So the situational judgment test, this is a test which consists of 40 items, and you'll be allowed 85 minutes. When you first start the test, there will be some instructions in the first few slides, and we'll give you a few minutes just to read those. During those 3 minutes, you won't be able to click on any answers, so don't panic. It's not broken. It's just that we're giving you 3 minutes just to read through the instructions and get used to the platform. Each item will consist of a scenario and a number of possible responses. Some of the questions will be ranked, where you'll have 5 different options and you need to rank things from 1 to 5. And some will be extended multiple choice questions, where you'll be asked to select 3 potential answers out of a longer list. In terms of coming up with the pass score, we use a peer reference standard, and the result will contribute to the final ranking. So for those who do get shortlisted and go to interview, the final ranking score will be a composite of the clinical problem solving test, the situational judgment test, and the multiple mini interview. I want to flag that there is a glossary in case there are any terms or acronyms that you're not familiar with. That will be on the first page. Please use it and refer to it. You'll be able to toggle forward and back, so that is there for your reference. The second part is the clinical problem solving test. This will be a 50-question online test, and you have 60 minutes. Again, we'll permit you a couple of minutes to read the instructions, and you won't be able to click on any answers until those 2 minutes are over. So it's a single best answer question, or a single best answer test. So again, you'll have a STEM and you'll have 5 possible options. In most situations, all will be plausible answers, and you need to select the best answer. It will be criterion referenced, so there will be a pass mark, and this will contribute again to the final composite score, and there'll be a glossary for any acronyms. So the test itself. So as we mentioned, it's online. You all know that at this stage, and we have a new platform this year. It's called Riser Assess. They're a big international platform. We've been very impressed with them so far, and I hope your user experience will be good. It is important that you use a laptop or desktop computer only. Please don't try and do the test on a phone or a tablet, because it won't work. And a key part is that you have a functioning camera. So please don't leave that till the 11th hour to set that up. You just need to have that all organized in advance. As part of the platform, there are some mandatory pre-test checks that need to be done by Tuesday the 22nd, so that's 9 days in advance, and that's just to make sure that your system is set up and you'll be able to manage the test. You'll get an email on Tuesday the 29th of October, and everything will come through, all the relevant information at that stage. I just want to flag that there'll be 2 pins, so you have a separate pin for each test. So for the clinical problem solving test, and also for the situational judgment test. So when you are sitting the exam, just having those pins ready will just avoid any unnecessary stress for you on the day. When you first log in, there'll be some pre-test validation. So for that, the system will capture an image. You'll be asked to show an ID, so a government ID or a passport ideally, and then there'll be a 360-degree room check. I flag this now so that you don't have any embarrassing situations and everything is nice and clear before they do the 360-degree room check. The test itself needs to be completed in a single session. It'll start with the situational judgment test. Then there'll be a 5-minute optional comfort break, and then the clinical problem solving test. So it should take roughly about 3 hours. During the test, there'll be IT support. During the testing windows, there'll be a live chat function with the online proctors if there is a technical issue. So the rules. So it's important that I go through these. This is a high stakes assessment. This is your route into general practice training in Ireland and onto the specialty register. And so it's important that we take security seriously. And so we have a remote invigilation, which I'll talk through in a little bit more detail in a second. And there's we take security very seriously. And so if there are any infringements, we have a low threshold for excluding people from the process. So please do pay attention when I'm going through the rules. You'll need to agree to a non-disclosure agreement and also a data sharing agreement. So the remote invigilation, that will be live proctoring throughout the exam. So there'll be continuous monitoring by people of the test. Please don't use the keyboard. Please only have a single window open. So moving between tabs, different windows, applications, that will all flag. Please be alone inside the room with all the windows and doors closed. I'm aware that I'm stating the obvious, but it's important that I state the obvious at this stage. Please turn off all other electronic devices. Please don't wear headphones. So I know that some people like to study wearing headphones, but obviously that could be a security breach, and so they're not permitted during the exam. Another slightly unusual one, but one that I should flag, just be careful of recurrently touching your ears. So if you have any clothing over your ears, if you're recurrently touching your ear, then that just flags to the proctors and they look into that. And please don't write on any paper. So tips. I think be prepared, have your ID ready, have your 2 pins ready to go. There's a medical glossary there to help you. There's no negative marking, so please answer all the questions. If you don't answer a question, you can't get any points, but you're not going to be docked. Please read all the questions carefully. There will be times where you'd like a little bit more information. The questions have been carefully worded so that you need to make a decision on what the best answer you feel is for the situation. So just do your best. And then my second plug, please read the guide to applicants. So I'll hand back to Martina now.
Great, thanks Ronan. And once you're successfully through the SJT and CPST, you'll be invited to complete application B. And at this stage, you'll be required to submit all the documentation that you will need to support your application. And there's 5 mandatory documents that you will need. It's your passport, a passport size photograph, eligibility for the trainee specialist division of the register, evidence of English language competency requirements, and your medical degree. There are optional supporting documents if you have a stamp 4, or you wish to apply for recognition of prior learning, or if you wish to let us know that you have additional qualifications. They can be submitted at that stage. Great, thanks Ronan. Again, I would say read the guide to applicants and the prospectus booklet. That cannot be overstated. You know, you'll garner a lot of information from reading through these booklets, and it's in your interest that you know all the information going into the exams, tests, I should say. Check the documents that you're uploading for legibility and correctness. You'd be surprised the amount of documents that we do receive that are not legible or the correct document before they're submitted. So I would advise you just to check that before you do upload them, and to check your application before you press submit. And you might want to print it off and save it, but don't leave it till the last minute. As I said, there's a lot of applications that are submitted late on, So just be advised just to submit early and get everything in order. As I mentioned earlier, you will be required to submit 2 references, and these are on BST standard forms. We don't take written references. They have to be on the standard format. And one must be your current or most recent employer, plus one other, and they should be within the last 3 years. Good. Best of luck. I'll hand you back to Ron.
Thanks, Martina. So now, over the next 8 or 9 minutes, I'll run through the interviews and the offers process. So Martina already mentioned the interviews are going to be on Wednesday and Thursday, the 12th and 13th of February, and they'll be online. We will be randomly allocating individuals to interview day and time slots. So just to flag that. The interview will last about 45 minutes and it's in multiple mini interview format. So lots of you will have done OSCEs in university, but essentially what the multiple mini interviews are that you'll have 7 brief stations or interviews. Most will be 5 minutes, one will be 10 on different topics. And for each interview, you'll have a different interviewer. And that means you'll have 7 different people assessing you. So it's really important to think about exam techniques, because how you do in one station won't have any impact on how you get on in the other station. So if you do have a station that doesn't go as well as you'd like it to, try and breathe it in and breathe it out and move on, because you can afford to not do as well in one and more than make up for it as you go on. So that'll be worth practicing. Each interview will cover a different topic. Again, we'll be looking to match the interview stations to different competencies. And then all the scores get combined to give an overall score. Most of the stations will have a brief scenario followed by 1 or 2 questions. And there will be a station where candidates will be asked to role play an encounter with either a patient or a relative. So scheme selection. As Martina mentioned, after the interview, you'll be asked to list your selection of schemes. 2 big asks. Please list all the schemes that you would consider joining. If you select 2 out of the 13 schemes, the chances of a place may be significantly reduced. And if you absolutely would not select a scheme, if you're offered it, then please don't list it. So it's getting that balance right. I want to flag to you that we have a linked application process this year, so it's being introduced for the first time. And the idea is that we want to facilitate applicants who wish to train in the same scheme. And more information for this is available in the guide to applicants and also on our website. But the idea is that we will give the 2 individuals the score of the lower person in the pairing, and this pairing could be anyone. It could be a friend, it could be a partner, so we're quite flexible on the criteria, but it's just a move towards more flexibility in GP training. But if you're interested in this, you need to flag it at this stage in the scheme selection, and I would encourage you, third plug, to look at the guide to applicants, which has more information on it. So the matching process, ultimately you'll have a composite selection score. So 10% will come from the clinical problem solving test, 30% will come from the situational judgment test, and then 60% from the multiple mini interview. And then we have to abide by HSE, so the Health Service Executive National Allocation Process. So offers. So if you receive an offer, you have 3 different options. If you accept the offer, you are allocated a place and you leave the process. If you withdraw, you leave the process, and that's that. If you decline an offer, then what happens is you go back into round 2, where if other places come available from people declining or withdrawing, then you will be considered for that position. So it's very unlikely, in fact, you won't be offered a lower ranked scheme. So just consider your response carefully. There are no deferrals permitted, so you can't get an offer for July 2025 and say, can I take it up in 2026? That's not our stance, that's the HSE, so the Health Service Executive stance, and ultimately they are the employer here, so we need to abide by that. And swaps aren't facilitated by the process. Kathy mentioned recognition of prior learning, so RPL. The demographic of people applying to GP training has changed over the years. So some of you may be interns, some of you may be SHOs, some of you may be registrars, some may even be consultants or GPs in different countries. And we are doing our best to recognize prior learning that people may have. So the current opportunities are, if you meet criteria for having a certain degree of experience in medicine, emergency medicine, or pediatrics, we will consider shortening your training by a year. So you need to have completed basic specialty training in each of the disciplines and then completed all of the relevant exams. So more of this information is available online and also in the guide to applicants. But it's worth having a look at it and seeing if this applies for you. Importantly, eligibility isn't a guarantee, so we will do our best to facilitate RPLs being approved. However, schemes can only accept a certain amount, but we'll do our best. Importantly, if you are looking at this and you still have exams to complete in 2025, you need to have done your exam and had your result by the 21st of March 2025. So this will allow people to sit the spring sitting of the postgraduate examinations in the 3 specialties, but not the summer sittings. And this is just so we can have everything lined up. A question that often comes in each year is whether international applicants can use their, so for example, the MRCP UK. And the answer is, what you need to do is you need to check if the Irish colleges, so for medicine, the RCPI, if they recognize your qualification. And there is some recognition, but we ask that you check with those colleges whether your qualifications are recognized, and then you can bring that to us rather than coming directly to us. Final plug of the evening, well, from me anyway. So please, yes, have a look at the prospectus, but especially ahead of the assessment in 3 weeks' time, have a look at the guide to applicants, because I think it's very important. Thank you, and I'm going to hand you back to Kathy.
Thank you, everybody. So a lot